Nowadays, I'm getting so many patients which are complaining about hair fall. So most of them are men.
If you are having receding hairline on a frontal or temporal area,
I have seen so many patients complaining about their patchy beard and less beard growth. So if you have these problems, this video is for you. So hair loss. What is hair loss? Hair loss is medically known as alopecia. Generally, it is the thinning of the hair around the temple and the crown area. Nowadays, most common age group suffering from hair loss is above 35 to 40 years. So in today's era of junk food, the most common cause is poor nutrition, imbalanced diet, alcohol and smoking, stress and poor sleep. So among these causes, one of the major cause is imbalanced diet, which leads to nutritional deficiencies. Some of the vitamins are vitamin D3, vitamin B12. As now, due to less sun exposure, vitamin D3 levels are on lower side. The very first thing which I recommend before starting the treatment are blood tests like thyroid profile, vitamin D3, vitamin B12 and iron profile. Here I would stress the fact that you should consult your doctor to know the cause of your hair fall. So now coming to the treatment, we have options like topicals, in which we have Minoxidil and others like Redensyl and Procapil. So coming to the Minoxidil is a synthetic ingredient which is used as a medication for hair loss. It helps by increasing the blood flow of the scalp, which increases the growth of your hair. So generally the patients which are using Minoxidil show complaints about itching, redness, dryness and flakiness of the skin. These are the side effects of Minoxidil. The patients which are having grade 1 and grade 2 of alopecia, I generally prescribe them topical Minoxidil. But the patients which are having high BP, heart diseases and the pregnant women, I do not prescribe Minoxidil. I recently came across a video on the social media where the influencer is applying 12 to 13 pumps of Minoxidil into the skin. You are just wasting your product. We don't need that much product on your head. It just might cause even more side effects. Now let's get into new upcomings alternatives of Minoxidil. Redensyl, Procapil and Elegance. These are generally plant derived. It helps by increasing the anagen growth phase of your hair and thus by targeting the stem cell. Redensyl is both safe and effective in men and women as it has less side effects than Minoxidil. I prescribe it to my patients when they are complaining about side effects of Minoxidil and they just want healthy and thicker hair. So how to use Redensyl? I'll tell you. Apply 2 to 3 puffs on your clean scalp followed by a massage. So the major key difference between the Minoxidil and the Redensyl is Minoxidil is having side effects but the Redensyl is not. You should use Minoxidil only after the consultation of the doctor. You can use Redensyl or your phone.
Hi, I am Dr. Mohneesh, consultant cosmetologist at SkinRx Clinic. Let's get into the causes of receding hairline, either frontal or temporal. The first one is genetics, second is stress, and third one is the unhealthy lifestyle. First one is genetics. If it runs in your family, then after a certain age, you will start noticing receding hairline. Second, stress. Nowadays, unhealthy lifestyle, bad routine leads to stress. Third one is hormonal. Low testosterone levels may lead to receding hairline. I have talked about this in detail in other video. Now coming to the treatment, a tried and tested product is Minoxidil, which we can use topically. Well-known side effects of Minoxidil are redness, itching, dryness and flakiness. Some plant-derived ingredients which I have talked about in my hair fall and men video will not be effective in receding hairline case. Although rare, if you are having bald patches on your scalp, you can use the same technique. And also avoid putting tension on your head and avoid tight ponytails.
Hi, I'm Dr. Mohneesh, consultant cosmetologist at SkinRx Clinic. Let's first understand what is your normal beard growth and when you have to consult your doctor. So the very first factor is genetics. आप अपनी फैमिली में देखते हैं कि फादर हैं, उनके फादर हैं, ग्रैंडफादर हैं, उनके beard नहीं है, कम है, तो it is genetics. So the second reason is hormonal. If you are having low testosterone levels, then you should consult your doctor. Now coming to the treatment for this concern, we have two options. First is apply minoxidil locally on a beard area. The second is use dermaroller with the application of minoxidil. I get this question very often, how to use minoxidil and in which quantity. So 2 pumps is the right quantity, one on this side and one on this side, followed by a gentle massage, and you can use a comb balls. As you know, minoxidil comes with many side effects which I have spoken in my previous video. Apart from massaging and using a comb, you can use a derma roller, but you have to be cautious while using derma roller. Something to be careful about using derma roller is you should sterilize your derma roller before and after, and please keep it in a clean place. If you want me to cover any other topic, leave comment. Please like and subscribe.